A health initiative organization, HACEY, has taken asthma outreach to health workers in Ibadan Southeast Local Government to reduce the prevalence of the disease among community members. Dr. Adetunji Ademola, the resource person for the outreach, said that asthma can be properly managed if one understands the symptoms that come with it.
So if you find somebody that is unconscious and can't breathe properly well, I think the next thing that a person should do is to take the person to the hospital where appropriate care, which includes giving some drugs and inhaler and the other things, can be administered to the patient. I think there are some efforts that are being made to effectively provide help for patients. For example, in many of the tertiary institutions, that are hospitals that I know of, there are drugs that asthmatic patients would need that are available. Even in primary healthcare centers like this too, they have short-acting beta agonists that are very, very important to relieve the symptoms of asthma. And also they have drugs like aminophylline and some other drugs. So I think the government is really making some effort to help asthma treatment. It's important that you always take your reliever, which is the inhaler, with you at all times, because who knows when the next attack is going to happen and it might be life-threatening. So an asthmatic patient should be someone that is very, very vigilant about their health, also careful about staying away from allergens that could also precipitate asthmatic attack. And also it is important that asthmatic patients see the doctor regularly, frequently, to ensure that they do not, they are properly managed and symptoms of asthmatic attack do not come up frequently. And also for healthcare practitioners, I think we also need to be vigilant and identifying cases that look like asthma, because some other things look like asthma but they are not asthma. So when we see things that look suggestive of asthma, we give prompt treatment to reverse the possibility of life-threatening cases or deaths.
The representative of HACEY, Tomilola Kimpelu, said the training was for health workers on asthma care, asthma relief, and education projects to reduce the prevalence of asthma in communities. Akimpelu said the training was conducted in 3 states, Oyo, Lagos, Ebonyi, and the Federal Capital Territory.
We have noticed that so many people have asthma and they do not even know, and we have lost so many lives to asthma. So, and then we know that health workers are the first person people rush patients to. This is why we organize this training, so that once patients with asthma come to them, they know how to treat them, they know how to take care of them, they know how to manage such cases. We just need to keep bringing up programs like this to educate more people, and I know that with the help of the government we would achieve more.
The officer in charge of Orania Primary Health Care, Adebumi Aremu, commended HACEY and said the training, which was educative, will be impactful on the practice.
It's an educative training. It will have good impact in our practices in the PHC especially. So I love it and I want more of it. There are some agents that is even supporting us, like your state health insurance agency. They are supporting health, the basic health. They are supporting us and the impact. So any health challenges is being supported by the government of Nigeria and your state as a whole.
Also, the Chief Nursing Officer of Agbongbon PHC, Olufunke Ayoade, said the training had opened their eyes and that will help them to educate people around them.
They have done well in opening our eyes to all the signs and symptoms. Then what we need to know, like maybe about avoiding allergies. So it will help a lot at the primary health care level, because we will be able to educate people about all these allergies and whatever they should prevent to avoid complications.